Hey everybody, Will Brink here, brinkzone.com. Welcome to the latest live stream. So my guest today is a buddy of mine, somebody I've known a long time, 90s, mid-90s or so, and he is a plastic surgeon. He is a competitive bodybuilder. He's also a heck of a nice guy, but we'll get to that in a second. So my friendship with Dr. Silverman goes back to about mid-90s. I was at the judges table, and this was at it was either the Mass States or the New Englands. He can probably correct me on which of these two it was, and sometimes we used to hold those together at the same day, but it was one of those two shows. And we were supposed to judge this class. I think it was the light heavies. I believe it was the light heavy class, and there was a big holdup, and we're waiting for the light heavies, and we're waiting. And finally, Mike Katz, who you all know, of course, the famous Mike Katz, who was our MC for the show, was always our MC for that show. Also just a great guy. And Mike said, look, the reason that we're having a holdup is that one of our competitors is a medical doctor. And he's late because he's reattaching somebody's thumb. He's a plastic surgeon, and he's on his way, and he called in, and we're going to hold up the show for him. And I said, oh, wow, great. That's pretty cool. So at that point, so running down the back of the audience comes Rick, runs up on stage. Everybody's like, hooray, doctor's here. And Mike interviews him a little bit. I don't remember if it was before or after they posed and stuff. But, Mike brought him up and said, what happened? So Dr. Silverman gave a little talk about that kind of last minute in the ER. Somebody came in with a detached thumb, which he reattached. And, I've never actually asked him what the follow-up was to that, if he even knew if the thumb was functional after that. So that was my first introduction to Dr. Silverman. And, we were friends after that. We would meet up for lunch and talk over the years, because his practice was not far from where I lived in Newton. So I also went down there a couple of times to visit him. He also has a well-known party in Boston that was always well attended, the Blizzard Party, which was lots of fun. It's one of the I don't miss a lot about New England, but the Blizzard Party was one of the few things that actually made that boring ass, cold, expensive place worth living. Besides that, he also does some philanthropic work, which he doesn't. He's a pretty humble guy, so he doesn't mention things like he spends a few weeks, at least a few weeks. We'll get into that in a minute, but I believe in Ecuador, but I'll get that. But it's a Central American country where he goes down with a team, for free, and fixes genetic abnormalities, cleft palate and stuff like that. I think that's the major, but again, we'll talk about that. So there, my history with Dr. Silverman goes way back, and he's a unique person for us to talk to, because you have a medical doctor, you have a competitive lifter, you have someone who's 61, who will have some excellent advice for people that are post 40, let's say, and aches and pains, and he's always lean. And like all of us, I'm sure he's had his fair share of aches and pains and stuff he's had to work through. So I think that I'm going to bring him in, and he can correct me on some of my factoids here. There he is. Dr. Silverman, how are you?
Nice to see you, Will.
Was I accurate on some of those dates and times, or?
You were correct. It was the New Englands, the 1996 New Englands.
Right.
I actually had arrived early that morning. I had been reattaching a thumb all night.
Okay.
And I wasn't registered for the contest.
Right.
My posing coach, Jimmy Broderick, had recommended that I jump in. I was in shape from competing the weekend before.
Right.
And so I got there at 7 in the morning and registered, and fell asleep in the back of the auditorium. And so maybe if I was late, that was it.
Okay, all right, because it was announced to us, because while I was facing the stage, it was announced to us that you were running late from attach. So it was more or less that you had stayed up all night attaching a thumb.
Correct.
Okay.
That guy did fine.
Right. And was that microvascular
Correct.
stuff to connect. I mean, that's the difficult part, right? Getting the blood supply.
Right. Yeah. I did a microsurgery fellowship in Taiwan and in Melbourne, Australia. So for most of my practice at UMass, which I was there from 1990 to 2000, I continued to do microsurgery. Then when I came into Boston, I stopped doing it. But
so UMass is a big teaching hospital, I recall, right? So a really good place for that. So was medicine always on the radar as the thing you were focused on, from early on?
Yeah, my parents say that from the age of 3, when I said that I wanted to be my uncle, and they said, well, you can't be your uncle, you could be like your uncle. And that's kind of, he was a radiologist, but he was my mentor, my dad's middle brother. And so, I kind of went through through college, high school and college with the idea that I wanted to go to medical school. And knowing that allowed me to do some other stuff. So I majored in German, which was different. And I did a couple overseas travel programs and did some research in Germany after my first year of medical school. And then went to South Africa as a medical student, did a rotation. And then during my training, spent some time overseas, starting with our trip to Ecuador in 1991 was the first year we went.
All right. So you've been doing that a long time then. I know that's been a long time. I don't know how long.
Yeah, this would have been our 30th year, actually.
Right.
So we didn't do 2021. We did do 2020 right before COVID. So we're trying to figure out what we can do next year. So
So COVID obviously put a hold on that for the Ecuador. So when did you decide? Did you know what your specialty was going to be early on, or when did you pick up on the plastic surgery interest?
Sure. I went to medical school at Penn State in Hershey, Pennsylvania, and as a medical student, I thought I was going to be a pediatrician. I kind of had liked that realm, and I had done some done some volunteer work as a high school student on the pediatric ward in my hometown. The thing is, when I saved pediatrics to my end of my 3rd year, and when I got there, I discovered I didn't like it enough to want to do it the rest of my life. So I kind of had to do an assessment of what I had done and enjoyed. And I'd spent 2 weeks on plastics and really liked it. I didn't see myself as a surgeon, but that kind of changed. And I did a 4-week rotation, fell in love with it. And that was
I would think pediatrician's that's a tough gig, man. I mean, you got to really love kids and challenges. And I mean, dealing with adults is hard enough. I would think with kids that would really be a certain personality type that might really take to that. Or
there are all sorts of folks in pediatrics, and it's a whole range. You could do neonatology, you could do adolescent medicine, whatever. And I probably would have ended up somewhere sort of in a family practice, adolescent medicine kind of thing, based on what my interests are. But the plastics, the surgery was so interesting, and a lot of it had to do with the people that I worked with as a medical student. They were just really interesting guys and doing cool things. They were creative. It was a much more creative area than general surgery seemed to be. And that's proven to be true. I've really enjoyed my career in plastic surgery, whereas I don't know that I would have enjoyed a career in general surgery.
It seems plastic surgery also seems a bit more progressive in adopting new techniques and that type of thing than other areas of surgery. Does that sound about right?
It is to a large extent, but I think that's possibly because a lot of what we do is a one-off. Every breast reduction is about the same. Every breast augmentation, everything that we do, for the most part, when you do something over and over again, it's pretty much the same. But plastics, we end up dealing with reconstructive situations that are unique and that you're never going to see that same thing again. So you're forced to become a bit more creative. And that creativity is rewarded. And so people don't shy away from taking a creative approach in plastics, I think, compared to some other areas.
And I guess so you take the creative approach and you can then sort of disseminate that information out to this one of case that you dealt with through case studies, or how do you tend to sort of just seminar conferences, or where does that get around?
Yeah, one-off things would be a case study that you might present if it's of value. And we've had some cases that we've done in Ecuador, for example, which are interesting, and we've shared those experiences with people. My area, which I'm sure we'll talk about, is my area of interest is gynecomastia. male breast reduction. And there is stuff that I do in that subspecialty of plastic surgery that other surgeons don't do because I do so much of it.
Right.
So, the burden then becomes my burden to share that information. So I do go around and give grand rounds on, care of gynecomastia. I've written some articles and stuff like that. So that's how we, generally share the information. And then meetings, go to meetings.
Right. Well, so, yeah, I mean, so it made a perfect, obviously, so a perfect segue for someone like yourself in bodybuilding, who obviously sees a lot of gyno, either, not in the office, but at shows and in the gym and whatever. I've seen enough of that myself.
Right.
So that you just sort of started to get patients that way. They knew you as a bodybuilder, as a plastics guy, and you started to get people coming in to take care of that.
Well, it all started with my friend Jimmy Broderick, who you know, and he was working at the gym that I trained at when I was a resident. And at UMass, our residency program we had an optional third year, is how it was described. And during that year, we spent 6 months as junior staff. And then the other 6 months, I did this microsurgery fellowship where we were paid by UMass, but we could go work anywhere in the world with any expert. And during my junior attending time, Jimmy referred my first gynecomastia patient to me. And it was a guy who had competed in the area, someone I'm sure you had judged at some point. Right. I did his surgery. It went well. I met other people through him. I came back from my fellowship when I met Jay Cutler at the Gold's Gym out in Worcester, became friends with him. And between Jimmy and then his now wife, Nancy Andrews, and Jay, the three of them encouraged me to compete the first time. So I kind of was contemplating doing the show at the gym. The Bay State Gym used to have their own in-gym competition. But in the meantime, I got asked to do a lecture for the orthopedic nursing group about bodybuilding. And so I did this 2-hour lecture. And at that lecture, prior to them being pros, Nancy Andrews and Jay Cutler guest posed for my nursing audience.
Right.
They had no idea what they were looking at, I think we had a sense of where those two were going.
Right. Well, and Jay must have been like 18 or something. I mean, he was really young.
He got his pro card that fall. So that was 1996.
Right. Yeah. He must have been pretty young because,
23, I think.
Even that old. All right. I used to see Jay at the shows, and he was, we used to hang out with Matt McLaughlin. Remember, those two were like inseparable pals. And God, Jay was huge. I mean, even at 17, 18, you knew this kid, he was just huge. And the genetics were so obviously there.
Yeah. Well, I met him in 93. So this was 3 years later at that point when I finally competed and gave the lecture and competed.
Right.
And then just from doing that, more patients came into my practice, and I became known as the guy to go to in this area. And the nice thing with gynecomastia is it's a great procedure that takes care of a problem that really afflicts a lot of men, whether they're bodybuilders or not.
Yeah.
So I'm helping a lot of people without having to really deal with a lot of health issues. That's kind of the nice thing about it. So
it's has your approach to gyno developed over the years? Has anything changed? Is it still pretty much a straightforward method you're using, or anything new and exciting that's we should be aware of?
I mean, there are things in gynecomastia, in terms of technology, vasor liposuction, laser assisted liposuction, power assisted liposuction. A lot of those things for most cases they don't add anything necessarily.
Right.
Conventional liposuction with excision of any glandular tissue works well for just about everybody. But there are certainly circumstances, and there are things that I've done, with my practice in terms of trying to get better results and, trying to make observations about the condition pre-op and what you can anticipate from your results post-op. So
is there, my understanding, and I don't know how much you've seen of this, but there's an increase in male breast cancer. What have you seen? Have you seen that going up over the when you send it out for pathology and?
Yeah, I've had in the 28 years or 29 years I've been doing the surgery, I've had 5 patients where we've identified breast cancer as an incidental finding in the specimen. The first three were guys who had a history of steroid use.
Mm-hmm.
And the first one was a 57-year-old power lifter who'd used back in the late 70s, early 80s.
Right.
And his was the first one that they identified. And the pathologist looked at it and he said, it's not really typical DCIS, ductal carcinoma in situ, which is the most common non-invasive type of breast cancer.
Mm-hmm.
But he couldn't identify it as something else. So that's what he had to call it.
Right.
And the other two patients that followed were the same. So all of those went on, and one was 29 and one was 32. One of them did have some family history, but it was not a typical DCIS. They haven't had any recurrence. They haven't, they've gotten routine follow-up. But
so non-invasive. So you haven't noticed any increase in it lately over the last 10 years or something?
Yeah, not as an incidental finding.
Okay.
Now, the other two patients did have more typical DCIS, and the last one actually had invasive cancer. So, but he's someone who I had been following for 12 years prior to his surgery. Just he didn't have the opportunity to do it prior to that. And then
was he more in line? Was his gynecomastia more from obesity?
It was obesity related.
All right. So that would probably lend again from a different type of driver to make that type of breast tissue and cancer and all that. Okay.
The other thing is that, I mean, there are thoughts that we're seeing increased rates of gynecomastia. I haven't seen that reflected in the literature anywhere, but a lot of discussion of some of these pesticides and things that are converted into estrogens that are floating around.
No, it's well, we know that testosterone levels in general are lower than they were, 50 years ago. We know obesity is going up. We obviously are ingesting a lot more xenoestrogens and so forth. So it would make sense that gyno would follow along with all that. Those are all kind of recipes for obvious gyno
rates are down, all sorts of things like that, or at least in this country. So it would follow. I haven't seen it in my practice so much, but
okay. So I guess for anybody that's interested, do you sort of advise them or anybody as far as best practices to avoid gyno besides the obvious, like don't get fat, or I mean, what do you advise these guys?
Well,
pre and post.
Yeah, the majority of guys that I see with gynecomastia just had bad luck during puberty. So, 30 to 70% of men will develop gynecomastia at some point in their life, based on statistics. And that number, if you're talking 30%, you're probably talking about guys with visible, even your mother knows it's gynecomastia.
Right.
When you get to 70%, you're talking about people like me who had a little pea behind my left nipple when I was going through puberty. It was there for a year and a half and then went away.
Right.
So that's most of the 30 to 70%, 95% of those resolve within 3 years. So they're not going to have a problem. The ones that don't resolve, they can manage it to a certain extent by staying leaner and so on, but they may still have that little, what I call tater tit, that little puffy
on the outer part of the nipple. Yeah.
Yeah. It just looks like the nipple has a tater tot under it.
Or a sort of areola outside of outer areola sort of thing. Well, is it normally, it starts off as a fluid. Does it given enough time, it sort of converts into some sort of what am I thinking of? Cystic sort of thing, right? It sort of goes from hard, soft, and then over time it gets scar tissue. Is that what happens?
Yeah, you get fibrous tissue. So that's when it's related to either steroids or medication or something,
right?
Where there's something stimulating that to happen. When it's through puberty, it can be all sorts of different presentations. Right. And like I say, 95% of those go away.
Just gets reabsorbed once the androgen levels come up and change the ratio. Right.
Exactly. So, but the ones that are acquired later in life, oftentimes, particularly with a less sophisticated user of either steroids or over the counter, rather really behind the counter, pro-hormone supplements, the guys who are doing that, if they're not very sophisticated and taking precautions to minimize their risk, each time they do a cycle, they get fibrous tissue that's laid down, scar tissue, basically. Right. And so the more times they do it, the more that becomes problematic and the actual lump or gland shows up.
Right. So there must be an inflammatory process going on to lay down scar tissue like that. There's got to be some sort of inflammatory process in that local area, some sort of attraction to immune cells or something like that.
Yeah, I mean, I'm not sure exactly if it's an inflammatory process as such. It's a proliferative process. So, you know, you're getting a proliferation of these cells that are sort of like breast tissue, but not really. And they have a fibrous stroma, and it's that fibrous stroma that doesn't go away after a while.
I see. All right.
So from the inflammatory perspective, I mean, you know, when you talk to someone who they'll say, oh, when I start my cycle, my nipples get tingly or itchy.
Itch or hurt or something like that, which
something's going on there that is an inflammatory process, but I don't know.
Yeah. I'm just thinking usually when the body sort of encapsulates something with a scar tissue, you know, it's fibrous, it's protective, you know, it's trying to basically wall this thing off, whatever.
Yeah,
whatever
I think this is more just a proliferative thing that as you look, it's not cystic, it's not encapsulated. It's just, you know,
it's just hard tissue that ends up there. So obviously it seems like the weightlifting and the bodybuilding has been pretty much in par with your medical interest all throughout. Which came first?
I was a fitness enthusiast through my plastic surgery training.
Right.
I had surgery for a herniated disc at the end of my residency during that junior attending time, actually. And after that, I continued to run for about a year. So that was 1993. I quit running in 1994. And after I quit, I'd been trying to gain 5 pounds for 10 years. Right. And after I quit running, over the following 3 years, I gained 60 pounds. And I had just been overtrained, underfed, underrested, everything imaginable that you could do wrong, I was doing wrong. My body fat ranged 2 to 4% on any given day. And Jimmy's dad used to say I should do one of his shows. I said, well, I'd be the tall, skinny, hairy division. I was literally 170 pounds ripped. But I didn't ever anticipate being a bodybuilder. You know, that's kind of was more accidental. But once I started doing it, and you know, you feel good about how you look, you feel good about being strong, the confidence level, all the things that come with having.
Well, you've got you've got good genetics, so you responded obviously pretty well to it, which is nice. That's motivating. That keeps you, that keeps you going.
Right. I
mean, you were what, light heavy at the New Englands?
Yeah. So when I started all this, I was 6'1". I started at 170 pounds. I gained my first 5 pounds in Australia, came back all excited to get to 180. And by the following year, I was 201. So, you know,
I mean, you were really lean at that show. I mean, I remember one thing, getting into shape was not a problem for you.
It still isn't. I can get lean easily. I can't grow very much, but I can get lean.
And that's usually one or the other. I have a sort of a hypothesis that I call it the catabolic or anabolic metabolism, for lack of a better term. There are some people that, they can put on muscle or one tissue or the other, doesn't matter, but they will put on tissue. And when they stop working out, they get fat. And then there's those other group that I sort of call them the catabolic metabolism, which I think is more you, where you can stay lean and you have a hard. Now, you probably, like me, when you stop working out, you probably lose weight, don't you? Yeah. And I do too. I lose weight. If I stop working out, I'll lose weight very quickly.
I mean, the ectomorph, endomorph, mesomorph description is very useful, I think. And I'm very ecto-meso. I kind of turned myself into meso by eating way too much food and not worrying about what I consumed. And I got up to, the heaviest I ever was 238. I still had abs. I mean, they weren't sharp, but they were there. Right. And, my shape never really changed at 35 pounds heavier than I am right now. So people look at me and think I look about the same. I'm 2 inches shorter and 30 pounds lighter, but it still looks about the same.
Yeah. People don't have a good eye for these things. This is one of my, what I lament about, people always complaining about bodybuilding, judging and stuff. And it's not as easy as people may think. I said, if you want to yell at the judges, go try it sometime and see if you can figure out second from third and sixth from seventh and, ninth from 11th and that type of thing. And
well, especially at more competitive
Yeah, yeah. And I've also found that bodybuilders do not necessarily make very good judges.
No.
Sometimes they do, sometimes they don't, but it's not a natural. It just, you either have an eye for it or you don't. And it's just one of those things, you know?
Yeah. But, well, and you know, I had the benefit of Jimmy, who had a great eye at the time, you know, and my experience learning how to pose from him,
right,
and with help from Jay and with Nancy, and getting a mirror and getting other people to give you that feedback, that was profoundly helpful.
right.
Which I think guys who try to learn from watching Pumping Iron or watching a video are missing out on the opportunity to get their best performance, or to present their best physique, because you can be amazing, and if you don't know how to hit the poses right,
and that is, you know, you're bringing up a very important point, because I have had, it's really surprising how many guys don't come back to the judges and ask, where could I do better? Right. So there's an ego. Two, the ones that did always did better.
Yeah.
And there's been a number of guys who would come down and say, you know, what could I do? I said, you know, you've got a great physique. You're in great shape. You just don't show it. You really don't. You really have to learn to show it. And I used to do posing clinics and work with people. I'm trying to remember Lee Apperson. Remember Lee Apperson? Yeah. So Lee is a great guy. And, you know, he would do that show every year, but he's a very nice guy. He'd always come down and ask questions. And he won the whole thing. He won in 1 year. He finally stopped over dieting, and I worked with him at the gym on his posing. And yeah, he finally pulled it all together. He got in shape, but he was just the worst poser, you know? Yeah. But once he got it together, but that's a good point, because that just happens a lot. That just happens all the time.
I judged a couple of shows for Nancy this past year, even though, you know, they were relatively smaller shows and whatnot. But, you know, there was the one show that the guy who ended up winning was posing terribly. And the guy who got second was a much better poser and almost beat the guy just because the guy, you know, couldn't hit he came back out. Someone obviously had told him, you know, a couple things to correct. And so when he came back out, he did better and hit the poses right. But it's amazing to me. And the people always say, do you need to smile? I say, you know, if you're up there and you have two physiques that are basically neck and neck, the guy who's smiling in my book is going to beat the guy
every time
taking a bowel movement, because it looks more comfortable.
Yeah, it's just, and you know, and a lot of that is not even conscious. It's just natural to be attracted to and connected to somebody who looks happy to be up there. Right. It's just the way it is. And if they don't look happy and they look like they're in pain or whatever, and as you said, they've got to be neck and neck, sure. But if they are, and that happens all the time, it is just human nature to want to sort of lean towards that person who's like, hey, I'm here. I own this. This is my stage, you know, and that look, you know, I used to say that, actually, I hope he's not watching this, but my old buddy, Craig Licker, who is a fantastic bodybuilder. I mean, really fantastic bodybuilder, but his stage presence was something I used to talk to him about a little bit. And I don't know if he listened. I don't think he did, but he just was very stone faced. He would be very serious. He didn't look like he was in pain, but he just had a very serious. And I said, Craig, you know, you're at the pro level where you're really up there with some of the best in the world. And I think, you know, you've got the body. This is not your problem. His posing was good. His posing was always really good. And man, when he was on, he was as good as, he was as good as like Lee Labrada or people like that. You know, I always thought of him as a slightly thicker Lee Labrada, you know? But I think a lot of it, I really think it was his stage presence that would hold him back a bit, you know? Sure. And, you know, I used to tell him that, but I don't think it had a lot of effect, but I mean, even at that really, the highest level, that's going to make all the difference in the world. And the other thing also is realizing that when you're in the back row, we're still looking at you. Right. Don't slouch and don't let your stomach hang out and don't look bored. We're looking at you the whole time. I mean, true. Yates what I know about Yates, it was so good about, he never let his guard down. Even when he was in the back, Yates was always holding his, you know, he had a big old tummy. I mean, if you caught the right angle, you know, people say that whatever gut they want to call, he had that too, but he didn't, you know, he was able to control it, you know. And as you know better than I do, because I haven't been on stage, but as you can contest, it's also a lot harder than it looks to be up there and make all that stuff work and do it with a smile. That's not easy.
Yeah.
The other thing I tell guys is they should be posing a half an hour a day.
Yep.
The other thing as I saw many times that you probably saw is guys gassing out. They literally would gas out on stage and they're pouring sweat and they're huffing and puffing, and they didn't realize that this is not as easy as it looks.
Yeah, no, I have a very dear friend who was going to compete this summer and had to kind of just wasn't where he wanted to be and wasn't ready for it based on the posing stuff. His physique looked great, but it happens. And you do. I tell people they got to start 8 to 10 weeks out minimum and be doing it, 15 minutes to a half hour a day. Yeah. And you can get as good a workout in posing as you can, I toyed with the idea of I couldn't compete this year because my surgery was the day after or the day before the Universe in June. Right. And then so I couldn't do the Masters Nationals. But I toyed with the idea of doing the North Americans because I was already working out again. Right. I couldn't hit a front double bicep because
you couldn't
my arm around right.
And it all does. I mean, the thumb is part of that entire chain. You can't fake it without the thumb part of the whole thing.
Right. But hitting poses, I could have got a workout in every day for a half hour hitting poses.
Now I know. Now speaking of that, actually, I mean, you've been still competing. You've been doing what, physique? Is that what you were doing?
Classic physique and physique.
Classic physique.
Yeah, 2019 and 2020.
Right. Yeah. So I mean, again, people should realize, even though we've known each other since the mid '90s, you've actually been competing on and off, continuously. For almost 30 years. I guess we'd have to say somewhere.
Yeah, I started in '96. I retired in 2005, and then at his show at 2018, I was chatting with Jay, and I joked with him about jumping into do the show for my 60th birthday.
Right.
He was encouraging, and then 2019 rolled around, and I thought to myself, this 60 is not going to be all that pretty. Let me try it this year. And I ended up winning his show. So, I didn't expect to do that well. Then I went on and did the University Nationals, and it was fun. It's fun to do again.
Yeah, I guess that was one area that I just never really pursued. The more people I worked with and the more people I trained and the more pre-contest prep and the more shows I judged, the less I was like, man, that's an awful lot of work for a plastic trophy. I mean, you got to do it because you want to do it. Because I have to say, I probably would have been a half decent middleweight, regionally. I think that was about as far as my genetics would have carried me. But I personally was like, the more people I worked with, the more hard work. I was like, boy, you got to do this because you want to do it. Because otherwise, it's not going to make you rich. That's for damn sure. You bet. And all the guys that I worked with and women over the years, I was always encouraging, but I was very clear that you better have another, a fallback. That you better have an education. An education and a career and stuff is absolutely essential to do this because you want to do it as a hobby. If it somehow ends up becoming your profession, that's great. But boy, don't count on it, because
I remember years ago, someone who had kind of seen either one of my articles in Muscle and Fitness or seen the Sport Pharma ads or something. They asked, "How do I get in a magazine?" I said, "Go to medical school." Yeah. I mean, I remember at that first show, that the New England's, there was also a guy who was a third-year law student. That when Mike Katz introduced him too, and that's how the plastic surgery thing came up. I said, "Oh, I like hearing when other people are doing things other than just fitness or this, that, or the other thing." I said, and I kind of told him that I was a medical student or a plastics fellow and had been up all night reattaching a thumb, and that's how that all came about. So that it definitely helps to be a little bit more multidimensional. Yeah, those are the guys that I think we find more interesting as competitors too.
Well, you've got to have a hook of some kind. I mean, whatever that may be. But I don't remember Fred Big O. Remember Fred from A Million Years Ago?
Yeah.
So I took some shots of Fred and I sent them to Bob Kennedy, and he was like, hey, guy's got a good physique, good body, but nothing out of the ordinary. I said, well, he's actually a financial analyst, who works at whatever it was. And he said, you know what, that, if you can take some pictures of him in the gym and like pictures in his suit, holding his briefcase, we'll do something on him. And that's how Fred got in. That's how I got Fred into Muscle Mag.
Yeah.
Now, I don't know if any of that turned out to be true, of course, but that's another story about him. But anyway, yeah. All right. So, I have to say, I actually jumped right. We're talking about gyno, and I'm looking down at my little notes here, and in underline, because I went right by it, it says boobs. Say it, boobs. We never got to boobs. We got the male boobs, but we never got to the good boobs, or my favorite boobs.
Your favorite boobs.
So changing topics only for a moment. I know gyno, but I mean, you obviously do a lot of breast implants.
Sure.
If we have some female competitors or the rare guy that wants breast implants, there are a few, but there are a few of those too. But anyway, I know you've done plenty of those. I'm assuming it's sort of a secondary specialty there.
Right.
Is there anything new and interesting going on in breast enhancement, breast replacement, shapes, fillings? I know textured became, a thing there.
Yeah, so there is some interesting stuff with breast augmentation. I mean, the more interesting things have to do with the evolution of the implants themselves, related to both health issues and outcome issues. So when I was finishing my fellowship, the thing that we worried about the most was fibrous capsular contracture, how to manage it, how to prevent it, so on and so forth. We had silicone implants that were, getting questioned and had been pulled off the market because of all sorts of problems and whatnot. So I finished my training in '93. In the first few years, we weren't really allowed to use anything but saline implants. The saltwater filled implants, except in certain circumstances we could use gel. And slowly gel became more available. But what happened was that the implant companies were forced to do work that really made much better implants in the end.
Right.
So the implants we have now are what's called cohesive gel implants. And that just means that the silicone that's inside of them has bonds that make it stick together more like, I don't like to use the jelly bean concept, and I'll talk about that more, but it's more like a jelly bean than a bag full of fluid.
So obviously less likely to leak. I'm assuming a more natural, more of a natural feel to them.
It depends on the degree of cohesiveness. So the ones that we use, generally speaking, have a more natural feel than a saline implant.
Yeah.
If you remember the gummy bear implant that was kind of pushed for a period of time in the transition stage, going from saline back to silicone gel. Yeah. The gummy bear implants were highly cohesive.
Yeah.
And they're a more firm feeling implant as well.
Right.
So women who got that almost feel like they have mild capsular contracture where the breast gets a little bit hard around the implant.
Right.
Whereas most of my I never used gummy bear implants.
Right.
But most of the implants I use are 4th generation or 5th generation silicone gel. So they're cohesive gel. Right. And it just means if they leak or they fail in some way, the stuff doesn't go all over the place. It stays pretty much confined to the breast.
So obviously that would be much less probability of some of the post breast implant illness that we've heard about that's gotten some attention.
Right. So breast implant illness has also changed its face over the course of time. When I was first in practice, breast implant illness was related to these women who had, claimed connective tissue disorders, fibromyalgia, all these various scleroderma, all these different things. And they felt that they were related to breast implants. What the research eventually showed was that those conditions occurred in the same incidence as whether you had breast implants or not. So the breast implants were not causal in developing that.
Yeah, I remember that, yeah.
But we had to kind of take into account that these women had real issues and real concerns, so that you want to kind of figure out what's the best option to avoid even those sort of potential problems.
Right.
So that's what a lot of the change in the implants has been aimed at. From the fibrous capsular contracture perspective, it also helped with that. Whatever they've done with the implants has made that condition much less common.
I had read that the implants with some texture for some reason was less likely to have that.
Right. So there are certain types of texturing that were shown to have a reduced incidence of capsular contracture.
Right.
Now the problem we run into in the past 5 to 7 years is a new condition. it's a type of cancer. It's a lymphoma
I've
that
heard-
occurs in the presence of textured implants.
I've heard that. Right.
So the new breast implant illness is sometimes related to that ALCL, it's called.
Right.
And the idea, the feeling that the understanding of what has caused this is the texturing causes a chronic inflammatory process, which prevents the capsular contracture.
Right, but it's irritating. It's irritating to the surrounding tissue. Right.
Lead to lymphoma.
Right.
So it's still getting understood better. The incidence is higher than what we thought initially. We're seeing more patients, and it can occur even in patients who had, for example, I use textured expanders for breast reconstruction, but I haven't put textured implants in since early in my practice.
Right.
I always use a smooth implant. It turns out that even having a textured implant for a period of time for expansion can put you at risk.
Interesting.
So, now they have smooth expanders with little tabs that you sew down so they don't shift.
Are there any, has anybody looked at or identified any labs? I mean, like CRP or some indicator of inflammation, IL-6, TNF-alpha?
I can't answer that specifically, but that is how they've identified this inflammatory process as leading to it.
Well, see, that makes sense. So you are seeing some histology, some seriological changes in that.
Right.
Okay. What is the, now we're going to go into goofy stuff. And I'm going to ask you a goofy question because too much science here. What is a woman comes to you, obviously, and she wants to get the goofiest giant bazumbas ever. Are you the kind of doctor that says, hey, it's your body, or do you try to sort of advise them to go in a direction, say, hey, I think these would fit a little better, or how do you approach that?
I'm not a one size fits all. So I will talk to them about what they want and try to get them the result they're looking for.
Right.
I do have a patient who I got a part saline, part silicone implant and overfilled it for her to get the size she was looking for, but she's also 6'2".
Right.
She wasn't a little 5'3" figure girl,
Okay.
So
I mean, I've judged some shows where the bikini models didn't do well because they were 5'2", 110 pounds, and had double E tits. Sorry, breast. And they would come down and say, I'm in shape, and and it's very hard for me as a man, because I had one girl in particular. And I said, look, you look great. I said, but you're not balanced. I was looking for the most, respectful way of saying, you either need to bring up your legs and your glutes considerably, or you may want to, if you want to place better, and that's really important to you, you may want to consider downsizing up top a bit, because you really are, and so she, I approached it as best as I could without being
it's an issue of symmetry.
Yes.
So, we all stress symmetry as judges and as competitors. And that goes for whether it's natural or unnatural.
Right.
So, I have a patient years ago. She was a beautiful girl. She kept placing 4th and 5th in all of her contests, but absolutely gorgeous. But her problem was she was pear-shaped. And even in great shape, her shoulders were not wide. They were okay.
Right.
Her hips she had really nice curvaceous hips, and she was lean.
Right.
She got breast implants, a very appropriate, nice average C, and started getting first.
And made all the difference. Right.
It's not because she had breasts. It's because she had symmetry.
Right. Yeah. Proportion.
I think as judges, we're judged falsely. So, you like the girl with the big boobs. No, I like the girl with symmetry.
Yeah. No, like I say, I know other judges next to me mark them down for big boobs if they're not proportionate to the rest of them.
Absolutely.
And if they're proportionate, then they're proportionate. But there's a point where no amount of, if your boobs are so big, you can't be in bikini. You're going to be in bodybuilding, and then you better be awfully lean to have. But even some of them, I mean, there were some bodybuilders that, even though they were big girls, they still were just too big. I mean, like Anne Marie Crooks, who I love. I mean, I thought she was a beautiful woman, but. And the other thing the difference between judges too, is that, as you have to separate, and not all judges can do this. You have to separate who you want to sleep with and who is the better bodybuilder?
Yeah.
And I was a new guy sitting next to me once. He's like, "Oh, she's beautiful," blah blah blah. And I said, "Look, dude, remember, she is beautiful, but who you want to bang and who is the better bodybuilder? You got to separate those two. Don't let your man, you know." Oh, he's like, "Oh yeah, you're right." I said, "So, you know," so I could see him working his way toward marking her up because she was so beautiful. And you know, and same thing with men too. It's the same deal. I mean, you know, just because he's a super handsome guy with a big grin and all that, it does help. It attracts you, but we're not judging them on
exactly.
Yeah, it's not a male model contest. So I think it's not easy for, you know, I think again, better judges can separate the, you know, the what are attraction or what's attractive versus, you know,
right. Or those people should compete in physique and bikini, because those are the places. Bikini and figure, we're judging on beauty and presence. Physique, you're judging on beauty and presence. Whatever that's called for guys.
Well, I mean, again, back when I was judging, there were very limited divisions, of course. Right. Now there's almost unlimited divisions, which I'm still getting used to. But I go back and forth on whether all right. So I got my immature, childish questions on boobs out of the way.
Always happy to answer those questions.
But I have to ask, but you are a medical doctor, and therefore I can get away with asking to 18-year-old questions. So going a little bit, so one thing I know people don't know, and I mentioned early on, I want to get to your charity work, which you've been doing for a long, long time, which you don't really make a big deal out of. And I have to say, I've always been pretty proud of that. I know it doesn't mean a lot coming from me, but I'm just saying that, as I've always told you, I just think that makes you a good human being underneath, you know, whatever we do. And a lot of people put their talk all day long about, you know, good, bad, who's good, you know, but at the end of the day, it's what you do. It's, do you step up and give your time, your whatever professional thing you can do to other human beings, without it having to be videotaped or on TikTok or some goddamn thing. Every minute of the day. And you've been doing that a long time. So you go down to Ecuador. You have been going almost every year for a couple of weeks?
Usually we go for about 9 to 10 days. Okay. We do a 1 week work week. We have had years where we've gone 2 sites for 2 weeks, right, with one team that is with us the whole 2 weeks, and then 2 alternating 1 week teams. So that's tough on my nursing staff. And now as we get older, we all have the ability to do some of those things a little bit more readily. But yeah, we've gone every year except this year so far. So
right, and it's mostly cleft palate, or is it a mix? Mostly people I've seen were cleft palate.
About a quarter of the cases we do is related to cleft lip and cleft palate.
Right.
About a quarter of the cases are related to hand and upper extremity issues.
Right.
We do a fair bit of burn reconstruction, particularly in Latacunga, where we go, which is up in the mountains.
Right.
But both where we go in the mountains and in the jungle, they use open heating systems for cooking and whatnot. So burn is very common.
Oh yeah.
And then we have I have a podiatrist who goes with us. So over the last 6 or 7 years, we've also done some foot and ankle work, which has been helpful. The burn stuff is mostly grafting type work? I mean, is that most of what's done? No, it's mostly scar revisions with some grafting, but it's usually, you know, a lot of it hand and upper extremity. We're trying to improve functional situations in many cases. Right. Or if it's a scar that's unstable, we'll try to correct an unstable scar. I mean,
the thing about doing that kind of thing, regardless, is that it obviously you'll agree, is what it gives you is perspective. It puts life in perspective really quickly, as to whatever our little problems are. And my Wi-Fi is not working in my nice condo in East Boston, or it's raining in West Palm Beach. One of the reasons, I on weekends I'm a volunteer. I'm an tour guide at the Navy SEAL Museum in Fort Pierce. And because Fort Pierce is where the Navy SEALs and frogmen were created. That's where we actually trained for Normandy right on Fort Pierce.
Oh wow!
And so it's a very historically important spot. And I like working there because I like history and all that. But one of the reasons I like it is because you know, I get guys, I'm complaining that I couldn't find a parking spot. And, you know, you'll get some guy comes missing both legs, you know, and he's as nice as could be. And he's like, how's your day? How's it going? And I'm like, I'm doing great. And I'm an asshole. I'm not going to complain for the rest of the week. I'm good, man. We get guys coming in, they're not a lot anymore, but, you know, they're in their 90s who trained on that beach, lost all their friends in Normandy. They're 95 years old. And for me, and what you do, and besides all the other benefits, it just really adds perspective to life.
No, absolutely.
And I guess my general point is, anybody listening to this, find something like that and do it, whatever it may be, because it will. Besides, you're helping somebody else, you will benefit from it as much, if not more, than they do.
Yeah, I think a hard thing that for a lot of us through the past year, where we've been somewhat isolated and unable to do a lot of the things we do, is you lose your sense of purpose.
Yeah.
And I think I see that, you know, my folks who are getting older, you know, my dad has worked, he's 86 years old, about to turn 87, and he's frustrated, even though he goes into the store, you know, they have a business, so he can go there every day, but he doesn't feel like he has the same responsibilities and whatnot, which he doesn't, you know, because he's not able to accommodate those. But the same thing, if you don't have a sense of purpose, it's very hard to make yourself get up and get out of bed in the morning.
Yeah.
You know, and your purpose can't always be getting to the gym and making you the best thing on the earth. Your purpose, oftentimes you get a greater sense of satisfaction from doing things for other people. And I certainly have found that in my lifetime. Right. You know, even if it's helping coach someone at the Boys and Girls Club, or you know,
whatever. I mean, whatever it is you can do.
Yeah.
You know, go do it. But I mean, that's something I feel like I can give back to the community.
Right.
But I've always tried to do something, and just through my own information that I give out constantly is the way I'm able to affect a lot of people at one time, whether it's an article or a video or whatever. So, so I guess go on to your training. I mean, sorry. So you've been at this a long time. What is your nutrition like these days? What is it? It's a big part of what's kept you lean and healthy and all that. So what is that? What's that like these days?
Yeah, so I don't have the greatest appetite on earth. I'm not a big eater necessarily. I mean, in my 30s and early 40s, when I was really pushing, you know, to get 3,500, 4,000 calories in my body a day, I did it. I don't know how I did it then, because I certainly couldn't do it now. You know, I had some, you know, rough stuff going through the last 10 years, and, you know, personal stuff and work related and injuries and different things. And a lot of that stuff comes back and sort of messes with your head. So appetite is not always my appetite is not always the best. Fortunately, cannabis can stimulate your appetite a little bit, so I find that to be useful. Yeah. But on top of that, you know, when I decided to compete in 2019, I had just been eating, you know, basically I'd eat 3 or 4 meals a day and have 3 protein shakes a day. That's kind of been my routine. You know, probably somewhere 2,500 calories a day.
Do you eat the pretty basic, typical bodybuilding fare? I mean, what are we talking? Broiled chicken and vegetables, or what are we eating?
I eat anything, and you know, I love Italian food, and because I just generally have a tendency to eat clean. Right. Naturally, I don't really have to worry that much that I'm eating bad stuff.
Plus, you're naturally lean, so
I'm naturally lean. Right. So I eat about 85 to 90% clean. Right. And then, you know, but I eat dessert, I eat cookies, I like ice cream, you know, I do whatever I want. I eat whatever I want. Right. During the contest prep, particularly the first one, it was such a good feeling to be hungry and actually want to eat.
Not having to force yourself, right?
Yeah. And so prepping for the Cutler in 2019, I did 2,100 calories a day, 250 grams of protein, 30 to 40 grams of fat, and the rest was carbs. Right. And I did that for 8 weeks, and I came in spot on right where I needed to be. Right. And then the interesting thing was then for the 2 months, once I decided to do the universe and whatnot, I had 2 months that I had to hover. And I had to hover through World Pride, you know, because now I have all these social commitments once summer comes around because of gay pride events and stuff like that. Right. We went to World Pride in New York, including a couple of big parties. I went to Providence Pride, Boston Pride, all these different things. Well, and I take my meals with me. You know?
I was going to say, you didn't use that as your sort of cheat period to have some drinks and a slice of pizza? And
I'm not a drinker, but you know,
Yeah.
leading up to the Masters Nationals in 2019. Leading up to that was Bear Week in Provincetown. Now I don't know if you're familiar with Bear Week, but that's all the big hairy guys.
Right. Well, I know what I'm familiar with a bear at least, so I can fill in the gaps there.
So the Sunday and Monday of that week, and my contest was Wednesday. Both of those nights, I had a slice of pizza and an ice cream cone at 1 a.m. And people were looking at me like, "Don't you have a contest this week?" I said, "Yeah, this is on my macros." Right. And I was eating that to keep my calories up.
You know, when I've trained, there's been a number of times when I trained, when I was doing pre-contest prep, where a day or two before and people were not coming in. I've sent them out for cheeseburgers or a couple slices. Sometimes that's what you got to do. And how many guys, the best they ever looked was 2 days after their show. Right. And because most people over diet until they can get their mind not to play so many tricks on them. But most guys often will overshoot the mark and come in flat. And was not uncommon that I would say, you know what you need to do? You need to go get a couple cheeseburgers, and because you're just flat. And it always worked. I mean, nobody ever had an issue with it. Yeah.
Well, and the thing that I ran into at the Universe last fall, or the Nationals actually last fall, was I was flat. Particularly by the time, and we had made a plan and whatnot, and I was either going to have a slice of pizza or a steak, and I had a steak. It didn't have much salt. I was just low on sodium, and that was the issue there. But had I had a burger that night, I'd have been perfect.
If you had a cheeseburger, nice salty cheeseburger, or a slice of pizza which has lots of salt in it, you probably would have been doing good. So training wise, all right. So what's do you have any injuries you work around that we should know about?
Yeah. So 2014, I was doing a seated row at the gym, and the cable snapped. I did a backflip and landed on my head.
Yeah, remember that? You had a neck. You had a neck injury. Remember that?
So in 2017, I had a disc replaced in my neck, and I had a lower back surgery related to that injury.
Right.
But through that, I missed 2 weeks of training each time. I get right back into it. And I've worked with my surgeons. I just had this thumb surgery. I work with my surgeons to make sure I'm not going to do anything bad for the operative site.
Right.
I started working out 9 days post-op after my thumb surgery. I had a cast on, and I knew my thumb was protected. And so I just did things I was able to do. And my right hand basically went along for the ride most of the time.
And there's data, as you know, that shows actually you can actually work. There's studies that show working one leg actually affects the other side. So even if you've got a broken leg, you should still actually go train the other leg. There's sort of a parasympathetic crossover or something there.
Yeah.
So what does your training look like these days? What's the 60-year-old bodybuilder look like training?
Just through this short period, I've been doing a push day, a pull day, a leg day, and a day off. So and then just rotating through that. Now I typically do one body part per day, once a week, and I'm moving back into that as I can get heavier weights again. But I'm training so much lighter than I used to train. And that all started with COVID. Last March, I thought I was competing July.
Right.
So when things hit, when the shit hit the fan with COVID, I was stuck in my apartment. We had bands. We borrowed the 25 and 40-pound dumbbells from the gym in the building. My partner trains a woman. She had the 9s, 12s, and 15s. We had those. I used my piano bench as a stability ball to do my ab stuff. And I was doing all sorts of exercises, maintaining through that whole period until the gyms reopened. I never lost anything.
Right. Yeah, I think a lot of people during COVID learned that you really don't need as much volume or as much weight as you really thought you did, at least for people that have been at it a long enough time.
Right. I think that's an important caveat.
And if you're willing to put a little time in and a little creativity, you really don't need all that much. I've actually gone back to whole body workouts for COVID. You know what? I'm not really that motivated to go back. I kind of like them.
Yeah.
I actually kind of enjoy them.
I was doing that at first after the surgery. When I was recovering, I would just do everything.
Yeah.
And then I kind of went to the 3-on-1 off thing. And that was working, but like I was kind of neglecting shoulders. And if I'm going to do physique competition, I need to.
Yeah, if you're still competing. But I actually found I kind of like it. And I don't have at the very most, I might just go back to upper lower split, I think. But I don't see myself going back to any sort of, shoulders, arm day or anything like that. Upper lower twice a week. Seems to do a pretty perfect.
I remember years ago, somebody was telling me how they saw Vince Taylor, training, and the heaviest weight he picked up was a 25-pound dumbbell. And, and you'd hear that. And at that point, I was still training really heavy.
Mhm.
And I always had to train heavy. I mean, I was drug-free most of my life. I've been on testosterone since I was 53, but I'm still basically a drug-free natural bodybuilder, with normal hormonal parameters.
Right.
And I always had to train heavy to feel it.
Right.
Now I find I can train lighter and just focus on the mind-muscle connection, and I'm staying where I need to be anyway. I'm not.
And you've reduced your injury potential dramatically.
Right.
So there's that thing. My advice again to people, at least over 40, 45, that's kind of things, is just because you can do something does not mean you should, because it's going to work. It works fine until it doesn't. They go, I'm still deadlifting XYZ, and I'm like, that's fine until you're not, and then when you're not, you're out for 6 months. Or whatever, or you're never coming back, or
And Will, the other thing to remember is I think a lot of guys start in their teens now. Yeah. We didn't, at least 60-year-olds, we didn't have gyms that way when we were that young. I mean, unless you were an athlete, you didn't have access to that. So I started lifting when I was in medical school, and I started bodybuilding, was in my mid-30s. So that whole idea of training heavy from an early age, you're really wearing things out a lot quicker.
You are. Yeah. And so, I mean, even I was talking to Dorian once, this was years ago, but, and he said, if I had smartened up and just trained lighter at some point, I'm sure I could have gotten a few more years of competition, but I just was so into my own thing. But because he only stopped, he stopped competing because he started tearing things. I mean, he started to tear biceps and a thigh but he had said, I bet you if I had just retroactively, instead of waiting to get injured to do it, you should do it, probably around some age, because you need to, if you're in it for the long haul, which is what we're supposed to be in it for, right? We're supposed to be in this forever. You're probably better off doing that prior to getting injury versus waiting till you tear something and saying, oh, maybe I should back off. I also just tend to do less or recommend just, less high risk stuff, because again, you don't have, there's no must do exercise that you actually must do, I think you can do, pick the stuff that is least injury prone. I'm assuming you probably are doing that. You go and pick these exercises, you can hit the body parts you want to hit, right?
Yeah, I mean, and I don't change it up a lot. I mean, I know, I'll learn something new now and again, but I have a regimen that works for the aches and pains that I have and the deficits that I have. And I can occasionally add something new in, but I'm very careful about it particularly because of my hands, and that's where.
And you can always, if you're using some common sense, you can find ways to work around with or through those injuries. But some people just don't, just aren't willing to do that. They're so used to that one exercise, whatever it is, that they're just going to try to find a way to grind through it until, like I don't do any heavy back squats anymore. I don't know if you're doing any like back squats, but I haven't done an actual back squat. I actually find lunges and like split squats and stuff just way more productive.
I haven't been able to squat with a bar on my neck since 2000.
Well, that's right. So, and even now with the thumb thing, I bet between the neck and the thumb thing,
it's not even an issue. I mean, I've been doing I was doing heavy leg press, and then I was advised, don't go so heavy, do 10 sets of 12 with a 1 minute rest in between. I'd go up to 5 plates, bang it out. And that's the bulk of my leg workout, plus some extra stuff.
Yeah.
I'm still doing that. And my knees are thanking me for it every day.
Right. So your basic choice of exercises are pretty straightforward. I'm assuming all the usual stuff, right? Whatever, more or less working around your particular injuries.
Yeah.
You'll probably do a lot of stuff really looking to keep that neutral neck and that neutral back kind of thing, right?
Yes, I'm a big fan of like hammer strength and those
right.
Kind of things.
So no more like heavy bent over rows. I'm assuming that's out.
I still do some decent. I mean, they're not heavy right now, but I'll bring those back up. I was doing stiffies up to 3 plates on either side. I'm doing them with a plate now, but that's to hold it as much
strict,
as
right.
But I'm getting as good a work. I mean, my hamstrings get sore from it, so
right. Supplement wise, any advice, recommendations that you recommend for the aging, maintenance, health, overall, joints?
Yeah, I mean, I've kind of been off my NSAIDs over the course of the summer, but I'm a big believer for leg day. I use a little, Aleve or ibuprofen. Supplement wise, I've gotten very lazy about it. I still use a protein shake a couple times a day, and other than that, I've been on testosterone replacement therapy since I was 53, as I said. I know all my friends who are doing a CC twice a week and, getting bigger and bigger and bigger. I have never even used a whole CC in a week. I do 0.75 a week, and I have
that's replacement. I mean, that's real replacement.
Yeah. And it keeps my numbers where they need to be. So, I stay 400 to 900. And, weight wise, I'm finally peaking back at 205. I'm 5'11" now, so that's a decent weight. I'm pretty lean.
Right. So anything besides TRT? Anything else you're doing? Anti-aging, longevity type stuff?
I haven't been so much. I mean, I take a vitamin every day, and
all right. So nothing. Okay. I was hoping you were going to hand out the magic secret elixir for being 60 and 205 and lean and all that stuff. All right.
I wisely chose my parents. That was
okay. Yeah. Well, I mean, it's attributed to Arnold, but I don't know if he said it or not. But people said, how do you succeed in bodybuilding? And he said, choose the right parents.
Right. Yeah.
I don't know if that was him, but anyway, it's always been one of my favorites.
I'll agree with that.
So all right. So I think we've covered most of it. Before we go, I guess, so do you have any advice for, or does anything change for people that are, say, 40, 50, and 60 in their lifting or their approach?
I think absolutely. I think your perspective has to change as you go through these various stages, because I don't remember, I don't know if you've hit this point, but I remember somewhere in my early 50s, I realized that it wasn't just a simple thing to step off a curb anymore.
Mm-hmm.
I'd step off a curb and screw up my knee or screw up my ankle. Things just started happening.
Yeah.
So it was in my 50s that I had to start paying attention to things a little bit more attentively, and, not do things that were stupid in terms of how I was training.
Right.
Injuries.
Longer warm up, I assume. I do a much longer warm up.
I have a 15-minute thing that I do. It's sort of a little combination of some yoga moves and some ab stuff and core stuff and flexibility, hip flexor stuff. Yeah. And I do that every workout.
Right. Yeah, me too. Yeah.
And that's what I start with. And, through COVID and through this stuff, I can turn that into a half-hour workout if I'm traveling, that I don't even have to lift a weight, and I can, do a little chest, do a little back, do whatever I need to do, and still get a nice, blood flow and body pump out of it.
Well, it's one thing that you learn. One thing you certainly learn as you get older, which you didn't appreciate, which was if you don't, just doing anything is half the battle. Like 50%, just showing up and doing something, half the battle. And the other part is that if it's not a great workout or whatever, it's not the end of the world. It's you'll be there tomorrow. I used to walk a mile through a blizzard, for that leg day, because I couldn't possibly miss that leg day. It was the end of the world type of thing. Whereas now it's like, I'll do it tomorrow, or I'll go, as you said, just get some blood flow. People that say they've got to have this certain, they can't work out unless they've got this equipment. Well, that's a bunch of nonsense.
Yeah.
You can do anything with anything.
And if that piece of carrot cake is calling your name, eat it.
Yeah. Yeah, that too. Right.
Not if your contest is tomorrow.
Right. Not if your contest tomorrow. But again, guilt, gets you nowhere. Gets you absolutely nowhere. You just have to, Dan Duchesne used to say that don't feel bad about eating that cheeseburger. Feel bad about not eating 2 cheeseburgers. And that was his, big. If you're gonna. And even when I had a training business a million years ago, when people would come and, because when you're a trainer, you're like half the job as a shrink. And they say, well, I ate a slice of pizza last night. Now what am I going to do? And I'm like, look, I didn't eat it. So I'm not going to get fat. So I don't care. 2, you should have had a few of them and now you're here. That's it. Let's just move on. Don't worry. And that's what I would tell them. You just have, because, there's a revolving thing to kind of get into that sort of guilt bullshit that just wastes time. You missed a day. Oh God, I'm a loser. I'll never work out again. You can't do that.
Well, and I think people start to torment themselves over the cheat day, and then they get so upset that they did it that they just keep cheating.
Yes. Yeah.
You know, it's a lot easier to do something now and again that kind of gives you pleasure and takes the pressure off.
Yeah.
You know? And that's why, I mean, you know, yes, I have a metabolism that allows me to eat what I want to eat. Yeah. But part of that is because I've always eaten smart.
Right.
You know,
right.
You know, if you do stuff that just, you make it a routine.
Yeah.
And
if you have the night or whatever that you eat more than you wanted to, and the next day you just eat a little less or whatever. It'll balance itself off in the week or whatever you need to, you know. A lot of people I know gained weight during COVID. I lost 6 pounds. I haven't gained any weight during COVID. I mean, yeah, I lost about 6 pounds. I went to see the doctor the other day. He was, you know, he said, everybody comes from my office has gained what we're calling the COVID-10.
Right.
The hospital now calls
COVID-19.
Yeah, well, COVID-19 would be even worse. But he said, you know, you're the only one that's come in here that actually lost 6 pounds since the last time I saw you.
Yeah.
And I said, well, I kind of focused on it because I was getting a little round in the front there, and my lipids, I've always had natural genetically kind of on the higher lipids, so I wanted to start to get a handle on that. But a lot of people used COVID as an excuse, not to say it wasn't hard. I mean, COVID absolutely is very challenging to get workouts in and not eat junk and stress out. But I think, as you were saying, you get into that cycle where you're not working out and you eat something shitty and you feel guilty, and then you just go into that, you go around and around that thing, and that's not productive for longevity.
Yeah, I think the other thing from a longevity perspective is if you can find a way to make exercise your refuge.
Yeah.
For me, you know, when nothing else was going right, and I'm not happy about much of anything, I can go to the gym and I can make myself feel good about how I feel. If my arm's screwed up, I'll do something else. If my legs
without putting a lot of pressure on yourself to make it this unbelievable workout. That's the thing.
Or go for a bike ride or take a walk, and whatever it is. But I think too oftentimes people kind of turn inward and shut down when really the better thing to do would be to get out and get some air.
Yes, and unfortunately, I mean, not to get political, but you know, they're closing the beaches and the parks and stuff, which was the worst. I mean, the worst thing, and there was no data. I mean, there was no science to support that. The chances, they should have said, they should have encouraged people to get out of the house, social distance for sure, but get to the beach, get to the park, go ride a bike. You know, that should have been encouraged.
Yeah,
in my view,
that's what I did. I did that around here. I'd have my mask on, and if I wasn't near anyone, I pull it down and ride along. Yeah. If I was getting near people, I pull it up.
They actually closed the beaches in Florida.
They did the same thing here.
Now, you could not find a better place to social distance than a fucking beach in Florida. Pardon my French, but could there be a better spot where you could get more room from other human beings on a goddamn beach? And
we went to P-Town all last summer and spent most of the time on the beach.
Well, there was a point where we were not able to go to the beach, and it would have been so good for my peace of mind. When I go to the beach, or I'm not that far, just was so good for my mood and all that. And when they wouldn't let me go to the beach, it was bad. It was bad for my health. You know.
Yeah, they did the same thing here. They blocked off all the parking areas.
Yeah. Right. Yeah. So I thought that was really bad messaging and bad policy right there. I understood obviously the indoor stuff. Obviously, I understood that fully. But the outdoor stuff, when they found out, and it was pretty early on, that your chances of getting COVID outdoors was non-existent. I think they should have said, "Get outside, people." You know, I was just reading a paper where the childhood obesity doubled in the last year.
I can believe it.
Yeah, and obviously, you know, I mean, COVID is obviously a legit threat, but obesity is a much bigger threat.
Yeah.
And kids, when they get obese, you're putting them behind the metabolic 8 ball for the rest of their damn life. You know, like that. All right, so enough of my ranting.
An appropriate
does anybody have any questions for Dr. Silverman before we let him go? He's got to get back to working out, saving the world, and all that. If anybody's got any questions, I think we covered most of all the good stuff. Good to see you. Let me know if you want to come down to Florida or visit me in Panama or whatever.
Yeah,
I think sometimes the comments box. What happens sometimes the comments box doesn't always work, and then when I log off, there's a bunch of comments that didn't show up. So if anybody, I don't see anybody throwing any comments out at us, and that might be, we might have an issue there. That's usually I get a bunch of comments that scrolling along as we're talking. So anything else?
Yeah, feel free to if there's any questions or anything anyone sends, I'm happy to answer them after the fact. well.
Yeah, and Dr. Silverman can be found on IG. We've got IG page and a Facebook page, and of course, New England Surgical Associates. Is that
New England Plastic Surgical Associates?
Plastic Associates. Okay, so of course, anytime you want boobies, of course, and more complicated things, because he is an actual reconstructive, or you're a reconstructive plastic surgeon, aren't you?
Yeah, well, I'm changing the focus of my practice at this point, where I'm mostly just doing gynecomastia and then the bodybuilder related things, so breast implants and stuff like that. It's just that, this past year has shown me that the internet is a powerful force for good and for bad. And from the gynecomastia perspective, it's been great getting great patients into my practice. So,
okay,
that's what
I'll link the practice under the video and stuff when it's all up. And all that stuff. All right. Well, great to talk to you. I think we covered all the cool stuff, and I'll see you soon, or I'll talk to you soon. And good to catch up, Rick.
I'll have to make a trip down to get some of those crack cookies.
Yeah. I'm still making them. I brought some to the museum. And oh my God, these guys just about lost their mind. Yeah.
People still ask me about them.
Well, I mean, when she first moved in, because she's from the South.
Right.
And in the South, oh well, okay. Now a bunch of questions just popped up. This might have just happened. Hold on. Now let's not. Brandon is asking, what did you think of Arnold's training? I'm not sure what you'd have to add to that one, but
I think it was pretty effective.
yeah, there you go. He also is asking what might be optimal for TRT amount. What are your thoughts on that?
So the way that mine works is I use HCG twice a week.
Mm-hmm.
That stimulates my own production and keeps my testicles from shrinking up into almond sized little nuggets.
Mm-hmm.
And then it also is helpful if I'm off of my testosterone at all, I still have plenty of natural testosterone. Right. So when I started, I was on 0.5 of HCG twice a week sub-Q, and then I was on 60 milligrams of tescipionate once a week.
Well, that's very low.
And I was running 400 to 900 on that.
That's pretty, yeah. Okay. With the HCG, I guess. Yeah.
That was when I was 53. Now I'm 61 and I am on still a half a cc of the HCG twice a week. And I'm up to 150 milligrams of tescipionate, so 0.75.
Right.
And that again keeps me, 400 to 900.
Right. Tom Miller wants to know curious if your sleep regimen has changed over the years, or if your training recover stays stable with same sleep as when younger. It's a little odd the way you worded it, but.
So one of the problems that you run into as you get older sometimes is you have to get up more times during the night to pee.
Mm-hmm.
And I'm an every 2-hour guy.
Right.
I never used to get up. I used to get up once in the middle and then once in the morning.
Yeah, I'm about every 2-3 hours, somewhere in that ballpark. Yeah.
Yeah. So that sort of puts a damper on the sleep element of it. But I do get up and have a protein shake when I get up. So sometimes I have a couple things to eat during the night.
Right. All right. So you kill two birds with one stone, I suppose.
Exactly.
Okay.
Yeah.
Are you how many hours do you tend to get for sleep? You somebody needs a lot of sleep like I am?
No, I'm a 5 to 6 hour guy at night, and I love naps.
Right. Okay. Yeah. I need a lot of sleep. I always have, and I like naps.
Yeah.
I both sleep a lot and I nap. So
yeah. But this past year is totally, everything's messed up.
Yes.
COVID. Yeah. So I can't really say that I'm sleeping optimally.
Right. Yeah. No, I think everybody would admit that this year doesn't really count in the in the description of how things normally would be, or the quote unquote new normal for the year. Yeah, but I think we all are on the same page. Really, how would you even describe sleep patterns? Mood, appetite. I mean, all of it's been kind of dumped on its head, I think, for a lot of people. And then we've got this new wave coming through of fun. So it's been an interesting year.
It has been a very interesting year.
It has been an interesting year. It's going to be, it'll be a really interesting thing to talk about 10, 20 years from now in retrospect, assuming we haven't, offed ourselves or whatever.
We're still here.
If we're still here.
The asteroid hasn't landed.
Yeah. Yeah. If the asteroid hasn't landed, or, I feel like the government is trying to set us up for our first real experience with aliens. I feel like they're trying to give us the saw. I mean, have you seen all the stuff coming out?
Talking about Area 9 or whatever and all that.
I feel like they're trying to soft land us into the fact that it's, that we're going to be exposed to this sooner than later, and we better stop denying it's true and all that.
I'm totally pumped. I would love to get picked up by the aliens.
I have been wishing. They always pick some poor damn farmer who doesn't want to go. I would be like,
I'm totally willing.
Let's go. Where are we going next?
Yeah.
They always pick some guy who scares the shit out of him and drops him off. I have even since I was a kid. I mean, and I'm being dead serious. Even since I was a kid, I have always been like, get me off of this place. I'd be like, fellas, what's a little probing between friends? Check me out and let's go.
I was a huge Trekkie for the original series, and I totally could have been beamed up. No problem.
No problem.
Totally on board.
No problem. Like I say, I'm one of those guys. They can do some probe me, and if they got to check me out first, then we can go to wherever we're going. But I would be like, no, I don't want to go. They'd be, you ready to go back? I'd be like, no, I'm ready to go on with you guys. I'm ready to
check this place out. Let's go.
And I really am serious about that. So, but yeah, if we're still around, in retrospect to talk about this, once COVID becomes more endemic than pandemic, which I think we're heading in that direction.
Yeah.
Shortly, then maybe things will get back to normal. But I also I tend to think go a little off topic, but I mean I think there are, like anything, as awful as it is, there are some silver linings to this. For one, I think that there will be a huge newfound interest and focus on really understanding viruses.
Mm-hmm.
And I think there's the vaccines were almost a moonshot. A level of effort and money and research. Because if we want to get things done, like like atom bombs, going to the moon, and making pretty impressive vaccines in a year, if you remove enough red tape, you get the smartest people on it, and you throw money at it, we can accomplish damn near anything.
You need a warlike situation, which is what
exactly, and that's why I tend to call it like a moonshot. We only went to the moon to beat the Russians. I mean, literally, the only reason that all happened was we freaked out when they put that little crappy thing up at Sputnik. We lost our minds, and the same thing with I mean, it's unfortunate that something like that has to happen before we get motivated. But I think there are some silver linings to COVID that actually right in your town, it's called Moderna. Now, Moderna, I actually had stock in Moderna before all this took place because their focus is actually using mRNA to attack cancer. What they were trying to do was actually make cancer vaccines. Mm-hmm. And I think that will be another silver lining to this, that the use of mRNA technology is going to be accelerated considerably. And there will be targeted vaccines to your cancer that they'll be able to target that cancer, go right in there and mostly for solid tumors. Solid tumor, but I do think that, as awful as this is, that there are going to be some silver linings that are going to take place.
Well, it would be great to see some public health changes throughout the country that are needed, that are way under, there are groups that are way underserved that, they've known, but this has really shined a light on it. So
yeah, I hope so. I'm skeptical, honestly. Well, I hope, everybody talks a big talk when this stuff's going on, and then when it's over, they're right back to serving the people with the money and the contacts. But we'll see. But I do think there will be some silver linings in some areas in science, maybe in public health, as you say. I hope in public health too. Yeah. I don't think anybody, regardless of where they come from on this, think that our leaders, quote unquote, let us down on this one. The messaging was bad. The politicization was bad, no matter where you fall on it. The polarization was for shit. Yeah. And what I like to say is that when this is all over, there's going to be a lot of finger pointing, and they'll all be right.
Yeah, exactly. Everybody's right.
They're all going to be right. Yeah, right. And I hope some of them are held to task. Yeah. On like I say, on the spectrum, regardless, because basically they stuck us in the middle. Yeah. So everybody, made their dividing line of where they fell, and politicized it and weaponized it from day one. And like I say, and we were stuck in the middle of this. And I hope people remember that. And I really do. And I don't care what their political, sides are. I really think that our quote unquote leaders really threw us under the bus for their own political gain on this one.
Yeah, and on both sides.
Yeah, on both sides. Yeah, that's what I'm saying. There'll be a lot of finger pointing, and it'll all be correct. So, come like I said, that I hope again. Maybe there'll be a silver lining, maybe there won't be, but I think there'll be a 9/11 commission level of investigation as to where things went right and where they didn't.
Yeah,
and, it's not going to look good, I think, for a lot of big names out there on, like I say, either end of the spectrum.
Right. It would be nice if real change that was positive comes out.
Yeah.
You're never sure that's.
Yeah. I'm starting a new political group called Alt Middle.
I'm with you.
Yeah, and I think that if we could actually start a political group called Alt Middle and stick to it, which is I think we could actually have a movement going on there.
Yeah.
That's what I think. There
was a New York Times article a few weeks ago that gave you 6 new political parties that you could kind of figure out which one you would fall into. Mm-hmm. And it was an interesting thing to look at, because I mean, you always think that I always figure I'm more in the middle than I am, but
right. I've done some political tests, like online tests you can take.
Yeah,
I usually fall about where I'm pretty I'm really libertarian. I mean, small L. I like to say small L libertarian.
Yeah.
I'm not a big L libertarian because there's some of their positions I don't love.
Right.
But again, I'm probably just a little right of center liberal. I'm pretty libertarian, which is to say, which is honestly the reality of a modern day libertarian in a sense is what you sort of call an old school Republican prior to who took, being taken over by the religious right, which is socially liberal and fiscally conservative. And
that's more I tend on the left side of things.
Yeah, right.
Because of social issues, but
right.
I mean, I'm about as conservative as they come from a fiscal perspective. I don't like wasting money anywhere.
Yeah, well, and that really is sort of what an old school Republican would have been prior to, like I say, it being pulled to the right so heavily. But yeah, I usually the tests I take bring me about libertarian, and I think a lot more people are. I think a lot of people don't realize they are libertarians. Like if you say, well, wouldn't you like to see the government stay out of your bedroom and let whatever you do with your body is your business? Oh yeah, absolutely. And wouldn't you like to see us stop wasting so much money and all that? Yeah, of course. I go, well, then you're probably a libertarian because you're not in the current manifestation, you're not a Republican and you're not a Democrat because one of those others just doesn't. And they kind of go, yeah, I hadn't really thought of it like that. And I go, yeah, the Libertarian Party, big L Libertarian Party is a little wacky, but the basic premise, I guess my point is that I really think if you dug half a dozen founders of this country out of the grave and stood them up, the only party they would identify with at all would be a modern day libertarian. Probably, yeah. I think that's the only thing that would make any sense to them at all. Small L. So, all right.
Yeah.
All right. I kept you on long enough. I don't see any other questions. So that was a good talk. We got into some good off politics and nobody died. This is good.
Absolutely.
Amazing, right? You can actually talk to each other with, with civility and
my entire, I am able to even talk to my family sometimes.
Yeah, I'm a little, I don't even do that, but yeah.
My younger brother and I, we're on, he's right, I'm left, but we're in the middle for the most part, so we can have conversation.
My sister and I, my sister is definitely more left, and so we find the common ground on the topics we can agree on.
Yep.
And then the other ones, I just sort of say, you know what, I don't want to go there. I just don't. Let's just stick to the stuff that we agree on, because we're the same way. My brother's on the left side, but he's not a political animal. But my sister gets herself wrapped up in these things.
Right.
So I think that's the way to go with it. But you actually can have a civil conversation with people if you're willing to at least be sure what it is you don't agree on, because sometimes you've got to, well, what is it we're not actually agreeing on? Maybe we agree more than we don't, and then you have to take it from there, I think.
Yeah, it's the listening that it comes down to, because people don't want to listen. They want to they already know what they think, so
Yeah.
they're not going to listen to what you're having to say.
Yeah, and they're just looking to reaffirm their own bias and their own position without listening to
And
anything.
unfortunately, one of the things that the internet and social media and all this has done is it makes that echo chamber that we think that what we are thinking is what everyone's thinking, and it's not. Just not.
And then you just end up in the surrounding yourself with people that are thinking the same thing.
Exactly. Yeah.
And I try not to fall into that trap the best that I can.
Yeah. It's hard.
You know, yeah, it's hard because again, people will talk at you, especially on the internet, and nothing you say back has an effect, and that irritates you. And then you're like, well, okay, you know, hell with you. I'm going to ban you, or I'm going to go to another. You know.
Yeah, I don't block people unless I'll quit looking at stories or something like that, but I don't block people because it doesn't do you any good to come out.
Yeah, I will block people on occasion, but I will always warn them. I mean, I'll always say, look, I don't want that on my page. And so please drop it. Otherwise, you know, I'm going to show you the door. I always at least give them a warning and stuff, because, you know, you're going to come into my house and then you're going to call me, you know, a dickhead or whatever. I'm not going to tolerate abuse on my own page, you know. So yeah, if they push it a little bit,
I'll
block them.
You own it. You're allowed.
Yeah, no, exactly. That's my, you know, and I like to say that the internet is the greatest democracy on earth. My Facebook page is not.
Right.
Or my web page or my whatever page is not. Just like, you know, my mother used to say when I was a kid at home, she said, well, no, it's not a democracy in here. Outside the apartment, it is. But no, you've mistaken. Inside is not a democracy, you know, and you don't have to like it. You just have to do it. And okay. You know, because I try to be a smart ass and say, you know, I thought we were living in a democracy. She said, no, we're not here. We're not in the house. We're not. No. That's not
patriarchy.
Yeah.
She's in charge.
Yeah. She was the meanest man you ever met.
Oh my goodness. That's hilarious.
All right, my friend. So let's catch up again sometime, and let me know if you, when the weather really sucks and it's dark at 3 o'clock and it's snowing and your taxes just went up, you can come down and visit me. You guys can come down here.
Awesome.
All right.
Great talking to you.
All right, Rick. See you, my friend.
Be well. Take care.